talking about kind of as a medical student, you know, talking to residents, talking to attendings, kind of what is your initial kind of feeling when you had those conversations? Is it a little bit more intimidating, or kind of what do you feel?
I think usually it's intimidating, especially whenever I shadow. Generally, I feel very awkward whenever I shadow because
Sure.
I recognize stuff. I've learned some of this stuff, but I also haven't seen it in person, or at least I haven't seen it since like October at
Sure.
the most
Sure.
recent, because that was whenever we finished up anatomy. So um, it usually feels a little intimidating. And then depending on how the attending or the resident is, whenever I meet them, I feel a little more easygoing. But I
Sure.
think in
Sure.
general, the learning environment as a medical student, you do feel kind of like, okay, I don't know what I'm doing, and then the hospital employees around you, they all know each other too, and you're kind of just like standing there. So it can
Yeah.
be a little intimidating.
For sure, for sure. I think I had a very similar experience. I know I'm very far removed, but I still remember kind of my first time interacting with residents and attendings. And, you are very kind of, in a sense, very kind of shy, like you said, is a good word, right? Of course, a little bit intimidated, but at the same time, right? At least for me, not sure your experience, but when I was a first year, second year student talking to a resident attending, you're a little bit starstruck too, because you think that that's
Yeah.
that's kind of what you're leading to and what you want to become. I'm
Yeah.
not sure if you've had that kind of
Yeah,
same kind of
I mean, even
interaction
with
too.
you, yeah, like, because I'm over here at the very beginning of my training. I'm like first year medical
Sure.
school, and then you're in your last year of residency. So there is a little bit of that starstruck feeling that you're describing, like, oh my gosh, like
Sure.
that's gonna be me in 8 years. I think it's 8 years.
Sure. Sure. No, for sure. For sure. For sure. And I think one of the things that make it intimidating is like because of this kind of, I would say love hate feeling, right? Where you're like intimidated, right? But also starstruck. But like, yeah, I think that adds kind of quite a bit of pressure. I'm not sure if you feel that kind of same way when you're around attendings or residents that you kind of want to perform at, a higher level, right?
Yeah, it doesn't usually happen, but
Yeah. Hey, trust me, it took me a long, long time. And even then, sometimes with the guys that are at top of the ENT field, you feel like you're still always a couple steps behind. So I think that feeling never goes away completely, right?
yeah.
Medicine is a learning kind of field forever, right? You never completely done learning. So
Yeah.
for sure.